the County of Milwaukee on June 6th decided to declare racism a public health crisis. And we thought that was a really great idea, and Chicago should follow suit. So we've made these postcards that are going to be handed out to you in the audience, addressed to Mayor Lori Lightfoot, and I'm just going to read it to you. If you guys don't mind filling them in and then turning them into us, we'll mail them in mass to Mayor Lightfoot. Basically, it's filling in your zip code, which you need to do. Then we will figure out the lifespan that you're expected to live to. In Chicago, there's a 30-year, and the panelists will talk about it, a 30-year life differential between communities on the south side and those on the north side. So we'll reference that. A recent New York University study found there to be a 30-year lifespan difference in Chicago. Based on this study, I will live to be approximately blank. That's what we'll do. Will you lead Chicago in declaring the 30-year lifespan gap that currently exists between the north and south and west side communities an emergency and disaster of the highest magnitude? Will you declare racism an official public health crisis as they've done in the County of Milwaukee? Sincerely. So this is just our attempt to, first attempt to try to bring change about in Chicago. But we also want to, the panelists can come up to the front, and as they're making their way up, we want to kind of feel the room, see how everybody's doing after the film. If you just want to shout out in a word or a statement what you're feeling right now. Anybody? Unsurprised. Embarrassed. Enraged. Sorry? Validated.
Bewildered.
Okay, bewildered. There will be a Q&A with the panelists when they're done talking, but I'm going to hand it over now to Jim Bloyd.
Thank you so much, Fernando. I'm Jim Bloyd, a steering committee member with the Collaborative for Health Equity Cook County, and we've just seen a real powerful film which has brought a lot of emotions to me. I've seen it, bits of it, and complete versions of it for about, maybe this is the third time. And I'm so glad I'm here this evening with you and with three colleagues and friends who are public health workers, all of us in different ways as I am. I've worked in public health for over 20 years at the local level, and I really want to recognize that there were 739 Chicagoans who died during the 1995 heat wave. And so it's something for us to really honor and keep in mind as we talk about this tonight and think about it in the days ahead. But I also want to point out that as Eric Kleinenberg talked about, the reason he wrote his book was that he was interested in doing a social autopsy. And those of us who work in public health, we're interested in doing the day-to-day prevention at the social level. The autopsy, of course, can tell us what happened, and so we can prevent future deaths. But this film is a very, very important and dramatic narrative that helps many of us describe what we're doing and thinking about all the time. So I just want to start out with that. Joining me is Fernando de Maio in the middle, professor at DePaul University in the public health program, a sociologist, co-author of a new book, Community Health Equity, a Chicago reader, organizer of a yearly health equity and social justice conference at DePaul, which I highly recommend, and co-chair of the Center for Community Health Equity. To his right, Wesley Epplin, also a steering committee leader of the Collaborative for Health Equity Cook County and Director of Equity at Health and Medicine Policy Research Group. He's helping create an Organizing Health Institute as a project of the Culture of Health Leaders team, and he's a co-founder of Radical Public Health at the University of Illinois at Chicago. And Brenda Rodriguez on the left is a labor and has been a labor and community organizer. She's a board member of Ixchel and a steering committee member of the Collaborative for Health Equity Cook County. She consults on worker co-ops and recently graduated with her public health degree from Johns Hopkins University. Congratulations. At the Sunday Part 1 panel on closing the life expectancy gap, epidemiologist Maureen Benjamin from Sinai Health Institute, where Steve Whitman worked after he left the Chicago Department of Public Health, said to us that the updated number of black Chicagoans who die, who are killed by the structures of racism and injustice, is higher now by 1,000 compared to those 3,200 deaths in 1995. She also noted that some U.S. cities do not have this shocking and unacceptable inequity in mortality. So panelists on Sunday, Linda Murray and David Ansell, Linda Murray, of course, who appeared in the film, were clear that the problem is oppression, that Stephen Whitman advocated an explicit stance naming racism, and that standing up for social justice is a confrontation with authority, and it means being a troublemaker. So let me start by reading two quotations that I hope can set the tone for this second panel this evening about closing the life expectancy gap. And I think, to me, the shorthand for the theme of tonight is naming names. James Baldwin said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." The Chilean poet Pablo Neruda wrote that, "But stand up, you stand up, but stand up with me and let us go off together to fight face to face against the devil's webs, against the system that distributes hunger, against organized misery." So I'd like to ask each of the panelists to start off by giving us your opinion. Who is the organizer of misery? Poverty is created by policies, and people and organizations promote those policies. And we experts in public health know that poverty kills people. And in racist Cook County and racist Chicago, it kills people of color at higher rates than white people. Name the names behind those policies that create poverty, that kills so many black Chicagoans and Latinx Chicagoans and working Chicagoans. Let me start out. The previous Cook County Assessor Barrios and his ally, current board president Tony Preckwinkle, who appeared in the film briefly, allowed an extremely regressive and racist property system, tax system, to persist despite years of awareness and opportunity to fix that problem, according to the reports by ProPublica and jointly with the Chicago Tribune. This resulted in $2.2 billion of taxes shifted from undertaxed, wealthy white property owners onto overtaxed homes owned by people of color in low-income neighborhoods. Evidence in a suit against Joseph Barrios filed last year by Brighton Park Neighborhood Association, Logan Square Neighborhood Association, and the South Suburban Housing Center shows that black and Latinx neighborhoods were much more likely than white neighborhoods to be overassessed. Small apartment buildings in the trendy eastern parts of Humboldt Park and Logan Square were likely to catch a break, while many on the west side neighborhoods got hammered. So law firms reaped profits from this tax appeal system. A Barrios ally, Michael Madigan, who some of you may have heard of, is a founding member in the 6-member firm that has filed appeals on nearly $8.6 billion in assessed value since Barrios took office in December 2010, the most of any firm according to the appeals analysis. We were happy that in the past, Tony Preckwinkle appeared and decried the life expectancy difference, which we reported on in this report in 2012, but we were sorely disappointed when she supported again re-election of former assessor Barrios against a reformer, present tax assessor Fritz Kagi. So with that starting out, I'd like to turn it over and leave it up to you folks who'd like to start.
Thank you, Jim. I got a couple. Go ahead.
Okay. Okay. Good evening, everybody. It was a pleasure to watch this film with you, and I share many of the sentiments that you've already expressed, right, of this being a hard story to watch, and perhaps not a surprising story to watch, but a difficult story to watch. So before we go on with the conversation, very much congratulations to the filmmakers on, I think, a really excellent film that shows a very thoughtful way of how structural violence plays out in the city of Chicago, right? Structural being the social and political arrangements, and the violence being the harm that it's causing to people. So it's a very vivid illustration of how structural violence plays out in our city. I think trying to address Jim's question, which I think is a very good one, right, of naming names and being specific in our ideas and our models about the drivers of population health. If it's okay, I want to flip it and look at and give credit, I think, to one of the good things that has happened in the city of Chicago, and that's the Metropolitan Chicago Breast Cancer Task Force that Steve Whitman was also very much involved with, right? Naming racism and discrimination as a key driver of the inequality in breast cancer mortality, and then marshaling collective action, social activism, and science, right, and data analysis to eventually change the situation. And we're seeing a decrease in the inequality rate between black and white women in the city of Chicago. And I don't know of any other large U.S. city where that's happening. So all that is to say is that the main theme of the film, that none of this is natural, that this is man-made, as Dr. Murray reminded us, is very, very, very important, right? The inequalities that we see are created by social policies, and they can actually be changed as a result of concerted action.
Thank you for that introduction, Jim, and Fernando, for your comments. And I've seen this film maybe two and a half times now. Saw part of it, and then watched the full thing before tonight, and then again tonight. And just a wave after wave of emotion in terms of feeling the unfairness of our society and the city that I live in. I guess I want to come back to what Jim asked about naming names, right? I think a lot about taxation as well. Illinois is the 8th most regressive taxing state in the nation, and taxation is so important because when people in government tell us we don't have money for things, it has to do with how much money's coming in and how they're spending our money. So the 8th most regressive taxing state, that means that we tax our lowest income people in the state of Illinois at the highest state if we consider all of our state and local taxes together. This is according to the Institute for Taxation and Economic Policy. And so that has to do with property taxes, sales taxes, has to do with our income tax rate, which is currently flat, right? So that's going to come before the voters coming up, I believe, in the next election. So an opportunity to weigh in on that, right? So that there's an action opportunity to say we want a progressive income tax. But it's also, so for me, that is a system that is both classist and racist, right? Because of a racist society, people who are low income are disproportionately people of color, right? So for me, that system of taxation is racist, and that's an example, and it's one that we can shift. Our over-reliance on property taxes to fund education is another one. But I also want to come back to who's benefiting from that. So the people who are benefiting from that are our wealthiest residents, who are being taxed at a much lower rate, currently at about 7% if you consider all your state and local taxes together, compared to 14% for our lowest quintile. So that right there is a system that benefits the wealthy, going to be in this society, a racist society, disproportionately wealthy white folks in our state and in our city. The other thing I want to bring up is tax increment financing, right? So how many of you have heard of TIFs? All right, many of you. So this is one of the ways that Chicago funds development and has for a couple of decades now, a few decades, under Daley and under Rahm, very unfairly divided up. So basically we lock in what's going to our taxing bodies, to the corporate fund, to schools, to the parks, and whatever in a geographic zone, we'd lock that in. For 23 years, though, all the growth in that area, that goes into a separate pot, the mayor, a slush fund for the mayor to get to divide up and hand out to political friends, right? So about half under Mayor Rahm's first term, about half of it went to the downtown area. So when we see the inequity in terms of development, when we see parts of the city that have all kinds of beautiful streetscapes and all kinds of development happening in other parts that do not, and at the same time we're underfunding our schools, that's another issue of structural racism and class inequity, where the wealthiest, whitest parts of the city are getting beyond what they need, and black and brown parts of the city and low-income parts of the city are not getting what they need.
Thanks for sharing that. And thank you, Jim, for opening it up, and to both of you for your comments. I really enjoyed the film. I think somebody mentioned validated, and I was like, yes, right? I feel like it doesn't come as a surprise to folks who are from the city, but it still sucks, right? It's like not something we want to be seeing, but it's happening. And I think it's sort of like the way that it's happening and the slow motions. I really like the producers talking about that, this distance of like crisis and urgency versus slow and almost accepted, sort of like, oh, that's just the way things are, right? So in terms of naming names, I think you already mentioned it, Rahm Emanuel. I think it's one example that I can think of, someone who was pushing atrocious practices like closing schools, and instead, and many times like using those schools for like cop training, or pushing for taxpayer money to go towards a cop academy, right? So I feel like that's a very concrete example, right? That is really like linked to income disparities, right? And like something like education being something that it's not accessible, and the quality of that education that's related to funding. But I really wanted to talk about like how this is, like there are policies where we see the direct impact, but there's also others that we accept, right? Like the federal interest rate. So I feel like when they were talking about housing, right? And I was like, well, it's especially, or even like economic development, which is a realm that I'm in. It's not something that I was trained for, right? I come from public health. I did labor organizing, never thought that I would be helping people start businesses. And it's worker owned, but still it's a business, especially in the way our society is structured. But something that we say like, well, that's just the interest rate, and the way that that's shaped and formed, and really the genesis of that and who that is always impacting. It's something that I started looking into, like, well, who sets that rate, and like what are the requirements for getting a loan? Because till this day, those are still pretty discriminatory, right? If you talk to a lot of entrepreneurs of color, they'll be like, I've gone to the trainings, I've learned the financial literacy, I've done the boot camps, and yet the biggest barrier is capital, right? And then once you say you get the capital, in whatever shape that comes, it's saying like, oh, if you don't sell, it's kind of based upon you because you're a poor entrepreneur. And one of the things that I was really struck by is one of our board members at the Chicago Food Policy Action Council saying like, oftentimes in these rooms you hear like, leave it up to the market. Like, well, let the market decide. And it's kind of like, well, the market's racist, right? And like, you see that time and time again. If your insurer is discriminating against you, is not going to provide an insurance for your restaurant, right? That's already another barrier. So I think it's a whole system involved, starting with like private banks and the Federal Reserve, right? Sort of like, well, who are these folks who are setting these terms And why can't we think of another way that like really builds in economic development in a way that's not competitive, in a way that's not like we have $100,000, here you go, fight for it, from the same people that could benefit, right, from your community. So that's just two examples.
Thank you so much for the panelists. And in a minute, I'm going to just ask the audience to either contribute your comments or ask some questions to this group of public health workers. But first, I'm going to ask you all, what are opportunities for audience members to take action on either some of the policies that you've described? And so while you're thinking about that, I'd like to observe a couple of things. One is that I thought we would not need to talk about local kinds of hate speech against that's represented and talked about so much against the squad, Ilhan Omar and Ayanna Pressley and Rashida Tlaib and help me out here. AOC. Alexandria Ocasio-Cortez. But sadly, you know, as many of us may know, the local state Republican chiefs of Republican parties at the county level put up a hateful representation, really supporting this really dismaying and shocking attacks on our fellow citizens, our leaders. And I think something that occurred to me is in the literature, Nancy Krieger has authored a new article describing how the hate speech from during the Republican election really was responsible for, it's very likely to be responsible for a significant increase in the preterm birth rates in New York City. She describes this as an example of the kinds of stress that all of us experience. Actually, not all of us. In this case, it was particularly folks who are Latinx, Latina women, and their babies. And so it really shows that this kind of hatred and bigotry has actual effects. And I think we need to call out the names of those folks at the state level who are too close to home, frankly, as being responsible for real differences in child health and infant health, as this research shows from the journal BMJ of this year. So I'd like to ask you now, what kinds of opportunities for grassroots action or collective action comes to your minds as we leave this theater tonight and kind of wrestle with, for some of us, what might be some kinds of new information, and what I hope really will bolster the kinds of work that we all do every day. So whoever would like to start.
Is that okay? Yeah. I guess I have to take a somewhat pessimistic tone, even though I want to be optimistic about change and about the possibility of improvement. But this is a really deep-rooted problem, right? Like the first map of excess child mortality that I've been able to find in the city of Chicago is from 1901. Right? We have similar maps like the ones they've shown us in the film from the 1930s, looking at different mental health outcomes. We have these same maps that have been coming again and again and again over generations. And they're mostly, as one of the women in the film noted, they're accepted, right? We have this compassion gap. Right? We accept this as part and parcel of U.S. society, or just the fact of inequality and poverty in our communities. The fact that infant mortality is 3 times as high in the worst off communities as in the best off communities. Low birth weight is up to 20% in North Lawndale, whereas it's 3% in where I live. And we accept these things as natural, right? I don't think we'll ever hear political debate where these statistics are the focal point of the analysis, right? All of the criticism of the Affordable Care Act rested on the constitutionality of the individual mandate, perhaps budget deficits or fiscal impact. but it was never really about the effect that it would have on population health, and particularly on the health of the poorest people. So unless we can somehow change our collective priorities and our collective kind of sense of what's right and what's wrong towards this, right, towards acknowledging that the health of poor people matters, not just to them, but to all of us, because we're all in one community, it's kind of an uphill battle.
Wesley?
So I guess I want to ask the audience to take a moment and think back 17 years in your life and how old you were and where you were in life, what you did, and how much life you've lived in those 17 years. And I think about that a lot because that's the gap. If you look at across community areas in Chicago, that's the life expectancy gap. A recent study went down to the census tract level, and it's a worse story. It's a 30-year gap. So think about where you were 30 years ago. Let's get really real about the impact, right? We are missing people early. Family members are gone. Community members are gone. They're leaving our city. They're leaving Earth, right? They're dead, right? And so that to me is a moment for us to really reflect on that. And is that the kind of society we want to live in, where people are missing their family members? Some of us are missing our family members. And that, if that doesn't motivate us, then I don't know what will. So how many of you consider yourself to be an organizer of some type? Handful of us, all right? So I think every one of us has the capacity to organize, and I bet some of you who didn't raise your hands have done some level of organizing, right? So I think that the idea that you can get together with people and change things, organize yourselves, lay out what it is you want to see in the world, name the names, name the problems, name the injustice, and then go to the powers that be, right? Who has the decision-making authority to make a change? Maybe it's your alderman, maybe it's the mayor, maybe it's a combination thereof, maybe it's the representatives at the state level or at the federal level, or a combination again. And it could be at the more micro level. It could be at your place of work. It could be on your block, right? So whatever needs to change in society, we all are collectively responsible to get together and do organizing, to build power together, to demand the justice we want to see. And so I just want to raise that up as a mindset that we all need to embody and take on and make changes if we're tired of seeing those same maps that Fernando just mentioned and that we saw on the screen before. I'm tired of looking at those maps. I'm tired of the maps being roughly the same story. And until we get sick and tired enough of that and demand justice and make that change, the maps are going to stay the same.
I would say, well, I have a couple of examples, but we could use your capacity, your time, your skill sets, and your money, right? I feel like I see you all part of this movement. It's going to take all of us to address this in a couple of different ways. So I work for the Chicago Food Policy Action Council. So we, vaguely speaking, work on food policy, but really that's all across the food supply chain. So from farm workers, restaurant workers, food processors, to, also talking about nutrition and having access to good food. I work particularly with a group of urban farmers, right, who are constant need of help on their farmland that they're leasing, right? Usually they don't own it, they lease it, most of them. So if you're looking to help out with time and you're, have the ability to do so, we're looking for volunteers who can help out. In these urban farms owned by people of color on the south and west sides of the city. So that's one. And the other one is I also work on policy. And I think just today I was in a meeting with similar folks thinking about heat. So this feels very timely. And in our state, we don't have an OSHA heat standard. Right? Every year they try to pass it, and every year it gets squashed, and we can guess from who. And And so, that's like something that we can push for, right? If we have 1,000 people, 10,000 people signing up a petition or going down to Springfield and saying like, no, we need this. Heat is a real problem and workers shouldn't be exposed, right, to dangerous temperatures. So that's just a couple that come to mind. And lastly, I think also like the minimum wage, right? I know that that's something that we've passed in Chicago, but there are still workers who are exempt from that, and that includes farm workers, tip workers, domestic workers, right? There are folks who aren't classified as like having the right to a basic minimum wage. So I think, those are some examples. I don't know, there's like a follow-up, folks' emails, but there are ways to get involved, and this is Chicago. It's like really the land of organizers, right? So I feel like there's ways to plug in. But I would also suggest like fighting against the apathy. I think like we're so indunted with like so many things that are happening, right? Also globally, thinking about what ICE is doing to the Latinx community. So there's just a lot, but really fighting against that apathy and like extending, if you had a minute or two, signing a petition, but also like with your time and labor.
Those are excellent ideas, and I think I also wrestle with the issue of hopelessness or hope, and I find it I find my strength most often when I am with you all, when I'm with my colleagues who care about health justice. And so I would suggest that as you continue work or strengthen your existing work or embark on something you've never done before, that you do it together with other people. And so that's one of my recommendations. I do want to say that this postcard is a beginning powerful step, and I would encourage you to do this. Once you do this, you'll take the next step. So please support the wonderful filmmakers and send a message to the new Mayor Lightfoot, who incidentally has an Office of Equity, I believe. What are they going to do? If you're a resident here in Chicago and you're here, you care about this because you're here tonight, what is that equity office going to be doing? Are they just going to be talking? What are they saying? If they're saying the right things, what are they doing? So this is a real opportunity to find out. I would also encourage you to call the Chicago Department of Public Health, email them, tweet them, go on their Facebook page and say, are you going to show this to your staff? Are you going to sponsor screenings of this in neighborhoods? And I would encourage you to do that as well with the Cook County Department of Public Health. So at this point, I would like to open it up to the audience if you have a short comment or questions. Yes, sir.
Yeah, how you doing?
Good, thank you. How are you doing?
My name is Darren Strickland, and I'm a commercial and residential real estate appraiser. And I heard
we're
you
gonna get the
mention that Fritz. Hi, how you doing? My name is Darren Strickland, and I'm a commercial and residential real estate appraiser for. Oh, hello. Yeah, can you hear me? Yeah, my name is Darren Strickland, and I'm a commercial and residential real estate appraiser for almost 25 years. And you mentioned at some point that Fritz Craigie is a reformer. I'm doing tax appeals, and I've been doing them for several years, and those rates have not changed. Those practices that were going on with Barrios might be unfair, maybe in his first year, but those practices are still the same. Businesses are closing down because they tax outrageously. They are destroying neighborhoods. You go all across the city and you see these strip malls that are closed. That's because these taxes are outrageous. Not many of us can keep a job when you make a $100,000 mistake. I've appraised property where they were taxed, let's say for example, $190,000. When I got done with the appraisal, it was $86,000. And they got a tax bill for $100,000. How many of us can keep a job when we make that kind of it's not a mistake. You don't make a 100% mistake. So for me, I see the practice continuing and continuing destruction of the urban inner city.
I really. I really appreciate your point. I've had this exact same question, and I would really like to know what the timeline is for correcting this. And I think Mr. Kagi should respond to an email from you and from all of us and give us that timeline.
Well, if you can elect a new boss, but if the same people are working, you hardly correct that situation. The man that he signs the paper, but he can't do the legwork. So if you don't change the people that were in charge of enforcing those rates and that activity of the last 10 years from the last tenure, not much is gonna change.
Right.
Not much is gonna change. He can say whatever he want to do, but if the people under him employing those conditions don't change, nothing changes.
I take your point. Yeah, sir. Yeah.
Hello, my name is Ed. Good to see you, Darren.
Hey,
How are you, man? Okay. All right. I actually sued in federal court a burials in 2017. My case was thrown out because A, I didn't have an attorney, and I couldn't find an attorney to take the case, and B, the Cook County assessor burials was represented by Kim Fox's office for free, and they used every trick in the book to dismiss that case. They did not want that case to be settled by a federal judge. And the reason I filed it in federal court was I felt that with the present system that we have in Cook County of electing judges, I wouldn't have been able to get a fair judge because the judges are appointed for the most part by Madigan, by Burke, who also run tax appeal businesses. So the entire system is corrupt. And I'd like to say this, whatever we allow increases. That's true in everything in life. And we've allowed this to increase over the last half century.
Excuse me, sir, that I have got to ask you a question. Why couldn't you get yourself an attorney? What happened?
I could not find one.
Wait a minute, why?
One would take the case.
You,
Attorneys would much rather have an ambulance case and get paid than to go through a 3 or 4 or 5 year case and exert a lot of effort, even though it'd be much more impactful.
what about the American Civil Liberties Union?
Everyone, I can show you a list as long as my arm.
You got to be kidding.
No, I wish I was. I don't kid. I'm actually quite serious.
I think you guys are doing
That's
some
one of the most
organizing right here.
unbelievable things I've ever heard.
Sounds like there's some organizing potential here. So I hope you stay in touch with each other. Any other questions or thoughts? Any other final? Oh.
My name is Julian Roberts. I live in South Shore. I'm part of an organization called South Shore Works. I really believe that if you do this map in 10 years, South Shore will be on it. A significant part of the population that once lived in Robert Taylor homes, Ida B. Wells, have moved to South Shore. More and more we started to notice that buildings were being boarded up. That really started around the 2008 real estate crisis. And so it's spreading. I can't speak for whatever neighborhoods that may also be impacted by the same thing, but there's a significant part of the population that is moving in the South Shore. There's a big Section 8 development going on too. So South Shore Works is supposed to be trying to make things work better, getting grocery stores and things like that. But it's not so easy.
Thank you so much. Yes, sir.
I'd be a little bit interested to someday see Mr. Madigan and Mr. Burke here, and it would be rather interesting if you people were to send them an invitation of some sort and get this on film. I think that would really, really, really be one heck of a sensational documentary if somebody was to take the initiative to go to these people, talk to them, and quite frankly, really put a microphone in their face, whether they like it or not.
The vision that comes to me in hearing your words is maybe a community screening in front of their residents, because I doubt they'll be. I think there was the past film Michael Moore did, where the president of CEO at every screening didn't show up of the GM. Roger and me, and where's Roger, right? Right, thank you. Yep, yes, sir.
Yeah, I just wanted to make one comment or something that I think would be interesting and something that I feel like hasn't been as directly addressed. Like voter disenfranchisement, I imagine that many of the populations being affected by these heat waves and not being invested in are also going to be the communities that are being pushed out of our election system and are being disenfranchised very actively by politicians across the country. And I think that is something probably that's very important to consider when we're talking about making change. People are actively being disenfranchised and dying as a result of it.
I couldn't agree more. Yeah, Wesley?
Yeah, I just wanted to comment on that. It's also, I think, the ways in which our elections are funded, right? So Demos did a great report after the 2015 Chicago election that talked about where the donations were made in the city of Chicago. And, you know, it's titled something like how, you know, Chicago's wealthy white donor class distorts city policy, something along those lines. And it talks about 5 wards where the majority of our donations are made from. It's the part of the city that benefits the most from the TIFs. It's the part of the city that has the longest longevity, right? So the sense that power, and as expressed through those donations, gets that part of the city exactly what they need in terms of resources, right? So, I mean, all these things I think are very well linked to the maps that we see in terms of distribution of health and of death.
I think we'll have time for a couple more questions, and then we'll end for tonight. Yes, sir.
You get a sense in the film that there's really a call for a change in paradigm in how we think about prioritization and things like that. I'm wondering, you know, I get the sense that the public feels a sense of inequity, but just doesn't know how to address it. I'm wondering what the public health community should be doing to facilitate the public's thinking and concern about inequities, specifically related to what we saw in the film.
Well, you all ponder that, and I would challenge each of you to answer them in maybe 2 to 3 sentences max. That's a great question. Otherwise, if you want to keep going, let me first start out by saying my perspective is that governmental public health agencies need to be sharing what they know publicly, what they know. And I think at this stage of the game, most of the local health department leadership, particularly in the bigger cities, but probably across the country, understand what the science is about the social determinants of health and that structural issues drive these deaths. But it's not on their web pages. They encourage everybody to walk more, bicycle more, eat good food, and the frame is an individual behavior change approach, which leads to victim blaming, like we saw Mayor Daley doing.
Yeah, it's a great question, and I think the answer partly comes from a strengthened public health response, putting health equity as the front and center of its mission, but it's also the kind of the neighboring field of hospitals, right? Of doing a more authentic job with community health needs assessments, recognizing that the things that are driving patients to their institutions are not just the individual behaviors, but are the community patterns. And until we get hospitals to, and we have some bright spots of that happening, but until hospitals wholeheartedly shift their focus, we probably won't make that big of a dent in population health.
I'll add, I mean, I think that the idea of, that I brought up before, of organizing and building power for health equity is something that not just people in public health, but all health workers need to do with communities. Communities do that all the time. Community groups come together, whether they call themselves organizers or not, and make demands. They organize to change things in their community to make them better. But I think, you know, the biggest sector in Illinois' economy is health and social services. It's about 20% of all the jobs. There's a lot of people who work in, whether it's public health or health care or some notion of social services. So there's a lot of people there who believe in social justice, who believe in the health of communities. But what we're not doing enough of is activating the power that we do have, both as individuals, collectively, within our institutions, to stand with communities for their demands for justice. So real quick, the Organizing Health Institute that Jim mentioned during my introduction is something that myself and a few team members for our Culture of Health Leaders team has developed. If you're interested in doing that, if you have no experience with organizing, or even if you do have experience with organizing and you want to join us, we're going to have a training coming up in September 20th, 21st, to get people really just up to speed on what would organizing look like. And then if people want, they can join the Collaborative for Health Equity Cook County that a few of us are a part of, or find some other place in their community or just somewhere in Chicago or in Cook County to do some organizing, because we just need more people, right? Like, this is, like Dr. Murray said, this is not rocket science. We just got to make the demands.
Yeah, so I'll just quickly add, I like everything that y'all both shared. And the other thing too is having, and we do have many leaders, but more leaders like Dr. Linda Ray Murray. I feel like there's this sense of, when I think of government workers, of like them debating something like, can I do this? And like waiting for direction from above. And it's like, no, you can, right? And it starts like by taking initiative. And I feel like that could go across like all of our jobs, right? When there's this moment of like, we're waiting for direction or guidance. And it's like, that's more technical, and really stepping up to be an adaptive leader. So that's just something, cultural change, that I think often about when I think about bureaucracy. But the other thing I thought when you said your comment was like, why don't we do the director's thing? Her suggestion is like, we take all this money, we do all this like preventative work to address emergencies, disasters. But it's like, so what did it look like if we were to model that, but for a public health crisis, right? If we were to go to these neighborhoods and knock on everyone's door and like, how are you doing? And like talking about how they're feeling, from diabetes to mental health. Right, so I actually do like that idea a lot. It reminds me also about Cuba's approach to healthcare and how it's a fraction of the cost in the U.S. So yeah, you said that, and I was like totally thinking about lots of things, but I would really like to see that type of model. So let's imagine we have this budget. Let's imagine we have all this staff personnel. What does it look like? And can that be done under public health?